Hello, my name is Persia. Nicole, you can hang out with me Monday through Friday, 10 a.m. to 3 p.m. on 92Q. Today, we're talking about health coverage, for Marylanders and recent federal changes that will impact your health insurance in 2026. To help us with the questions, get them answered, connect all the dots. We have an expert with us, Mukeba White, representing the state's health insurance marketplace, Maryland Health Connection. Welcome on in.
Hello, everybody out there. Hello, Maryland. I am Mukeba White, consumer assistance worker with Maryland Health Connection, and I'm excited to be here today.
Absolutely. It's going to be an amazing conversation. I'm super excited for this. And as you're watching us, for wherever you're watching us from, if you have any questions, just type them on in on the chat. We're going to make sure we get them up on the screen to get them answered by Mukeba. So let's kick things off right now, okay? Maryland Health Connection, how does it work? Let's talk about those things.
All right, Maryland Health Connection, it is the connection for the state of Maryland. It's an insurance marketplace, one-stop shop where you'll have the opportunity to not just get an estimate of what a possible healthcare plan could be. You also have the option for others who are trained to do this, who are certified to do this, to assist you in completing your application. They're there to do everything for you, whether it be the application, giving you all of the concepts and ideas to be able to understand health insurance. What is a deductible? What is a premium? When do you pay your premium? Who do you contact if you purchase a healthcare plan? So we are here to assist, not just as a resource, but we oftentimes become great friends with each and every one of the customers that come through.
And I think that's the most important part right there, too, is being great friends, like having that connection. You know what I mean? When you talk about Maryland Health Connection, it really is a big connection. And I think every single time I've done events with you all and things like that, it really has been really warm and welcoming. And it doesn't feel like a business transaction. Like, you know what I mean?
That's the relationship I would honestly say that we try to build, because most people, once they enter into the marketplace and they purchase, they know that open enrollment is once a year. So they get a chance to come back and they'll remember you. They'll say, hey, how are you? Haven't seen you since last year. Or how was the holiday? So you build that rapport. They feel confident to get their questions answered. They feel as if whatever they discuss, whether it be health ailments, medications, or certain things that they feel like they wouldn't want to share with everybody, they begin to become open and share those things with you to be able to choose the best policy or best program for themselves. So it's a wonderful feeling.
Yeah, no, absolutely. For everybody involved, it's a wonderful feeling, helping somebody and, of course, getting that help as well. In the midst of all the questions that I'm sure that you have been asked, the biggest one is, when can people enroll? They want to know, when is the time to jump in?
Right now, yes, open enrollment started November 1st. So you have November 1st through January 15th. So you have from now to the next through holidays, Thanksgiving, Christmas, and going past the new year. But the most important part is, if you want that January 1st start date, you want to get that enrollment done before December 31st.
Yeah. And it's the perfect time, too. So if you're taking some time off for the holiday, if you're traveling, whatever it is, if you're riding passenger like I do, take that passenger time and do your open enrollment, hop on the phone, get it done, because I'm a passenger driver. So I have time.
I love being a passenger. I love that for you, because I love that for me. I love being a passenger. Gives you an opportunity to see the scenery. But this is the perfect time to get all of your questions asked. Those different things you want to ask, things you want to have answered. To prepare yourself to make the choice. I often say, start out early so that you can have the opportunity to just be able to say, I'm shopping. And you don't feel like you at the last minute, you have to say, I have to just choose anything. No, shop. Use the resource, use the tools, and then make your choices according to whatever your needs are.
Yeah. And I think the worst part about it is, when you're like you're cramming in and you're like the last mark when you have to hurry up and enroll, and you can't really figure out what plans fit best for you, what you should be doing over here. So really get the perfect opportunity right now. Start your open enrollment so you're not late and you're not running behind and you're cramming everything in, celebrate the holidays, with a peace of mind.
Absolutely. I always say, avoid the anxiety of the anticipation of, I got to get in last minute, or I want to get in before the crowd gets in. Just come early, get that. And I always say, get it done early. Get it done early. If you get it done early, As time continues on with the holidays, that's one less thing you have to worry about because you've already had that process done. You've already made your choices, and you also know what your 2026 finances are going to look like because you know the hard concrete black and white thing there, which is the numbers.
And numbers don't lie. So let's make sure we get the numbers in and we're
Yeah.
all prepared collectively. Let's talk about what is covered.
Okay, so in your plans, I try to explain to most people how to look at it is that you want to make sure that you get your health plans done with all of your visits, primary care, dental, vision. Some of them even have plans that will have certain little blurbs that are there for mental health as a resource. So especially going through the times that we're going through, mental health is important, and that's added into your health plans. So when you are looking to see what are the specifics for you, check off those things that's something that you know that you're going to need. If you know that you're going to need a plan that definitely focuses on having a prescription plan that's going to be a little bit more in depth, that's something that you may want to research a little bit more on. I often talk to individuals who will say things like, how can I find the perfect plan? The perfect plan is only the parts that you put together. That's the perfect plan. To say that it's one perfect plan on the marketplace is not. It's how you put together the parts that best suit you.
Yeah, I mean, I think that's a great advice right there too, because your perfect plan might not fit everybody else's perfect plan. So it's hard to tell somebody, hey, you should do this because you don't know their numbers, you don't know the situation and things like that. So really look at it and, dissect it. Take a couple of days and go back and say, hey, like this works for me, this doesn't work for me, and so forth, right?
I say it all the time. It's a one-stop shop where you can get everything, but it is not a one for all that fits. It's not. You have to sit through, because for some people, a premium is most important. They need to know what those hard concrete numbers are. They need to be able to put that with their budget and be able to say, this is what I can afford, no matter what the other plans are offering. But someone else may come in and say, hey, I'm good with paying, either more or less, but I'm more so functioning on what my deductible is because I have this particular need. Where others will say, hey, I want something that I can go to a particular doctor, or I can go and get these particular resources from wherever this is. So you got to be able to have your own notes set up. I'm an advocate for that. Have your questions, have your notes pre-written before you sit down with your consumer assistance worker. That way you don't feel as if you missed something.
Yeah, absolutely. And I want to remind you, as you are listening to us, watching us, wherever you are at right now, you can ask whatever questions you might have, so you can make sure we get it up here and we can get it answered for you. Because I'm pretty sure we have tons of questions as open enrollment is happening right now. Now let's talk about, the federal changes that have been affecting health coverage. A lot of people right now are kind of nervous about federal changes. What will happen next? What is happening right now? What are the federal changes affecting health coverage?
The federal changes that are affecting coverages right now and the premium increases. So some people are seeing that they're not eligible. Some people were seeing that the premiums have increased immensely. So I call it sticker shock right now. That's the bigger point. Outside of the sticker shock is the fact that maybe previous years you were deemed to be eligible for the tax credit, and that was a part of what you planned on. Well, it was a part of what you created your finances for, and it just did not work out for you this year. So the sticker shock is major when it comes to new federal changes. Those options that were there previously, where you were given that tax credit, that assistance, and for those things to not be there for you this year, it's definitely taken a toll on individuals.
Yeah, and also I was reading that, starting in 2026, Marylanders who are not eligible for Medicaid due to their immigration status and earn annual income below 100% of the federal poverty level, there's going to be some changes with that too. They will no longer qualify for the tax credits for private plans through Maryland Health Connection.
That is absolutely correct. So they have the 5-year bar. That's the number one. So if you received that tax credit previously, but this year is coming up, you have to go with several other qualifications. That 5-year or more bar, that's one. Definitely, like you talked about, that 100% federal poverty level. If you are there and below and you did not qualify for Medicaid, it was a program where, as though if you did not qualify for Medicaid, you would receive the tax credit to assist you and you would be able to purchase. This year, that is not the option. If it shows in your eligibility status that you do not qualify for the tax credit, you can still purchase health insurance, but you will be responsible for the entire premium.
So as you can see, there are some changes happening here. And make sure you know before you go to make sure you do your open enrollment so you can have your list all rolled out. Actually, there might be a good plan too, maybe. Write out a couple of things, your must-have things that you want to make sure you incorporate. Then go on and then make sure, okay, these are connected here and things like that. I'm like trying to stay more organized going into 2026. What about you, Mukeba?
It's an absolute must. I would tell anyone if they were planning to shop the marketplace or they were planning to go into the office to enroll, go on to MarylandHealthConnection.gov first. Use the estimator. Use every tool that they have on there to offer you. That will give you at that time, you'll be able to write down your questions. That's the bigger part. Look at the options, use the tools, write down your questions, see certain things that you did not see last year because they're going to tell you some of the laws and how things have changed. That's the one thing about the website. It's going to give you a ton of information, sometimes information overload, but get as much information as possible. Prepare yourself so that I'm not going to say that the sticker shock is not going to be an effect on you if you go and you use the website, but it will at least ease the situation and ease the anxiety where you are at that point where you know things are changing. My premium is going to increase. Now I just need to find out how much.
Yeah. And I think we all want to decrease the anxieties. We want to go in kind of knowing more things that we didn't before. So we can just woosah and get it done. Right? Come on, woosah and get it done.
Absolutely.
Now, Mukeba, of course, everybody wants to stay covered, right? What should people do to make sure they are staying covered?
The most important part is pay attention to dates. Dates are very important, whether it be open enrollment, which we talked about is November 1st through January 15th. In addition to that, after enrolling, please and thank you, always contact whoever your provider is to get information. Go onto their website. Of course, make your binder payment so that you will be connected with that particular person. Find out if there are stated dates that you may need to make your payments. Follow up on those things. If you need to return back to your consumer assistance worker to supporting information, maybe some documents you need to follow up with. If it's a date that is due, please follow. I always say follow those dates because they're important. Because if you go outside of those dates, oftentimes you're looking for some special assistance and we can't always promise that.
Yeah. So make sure you stay within those dates there. And of course, there are tons of questions, though. People still are going to have questions. It's still going to try to figure out how they can make certain things work. What kind of help with enrollment is available with Maryland Health Connection?
Maryland Health Connection has, major resources. So the biggest one is that they have their local community resources, which is Healthcare Access Maryland. And this is for all Marylanders. We have locations that are in Baltimore City, Baltimore County, Anne Arundel County, Howard County, and Frederick County. So there are resources everywhere. The biggest resource coming up is going to be after the first holiday, which is Thanksgiving. So it'll be coming up on November 29th. That particular event that we will be having is going to be from 10 a.m. into 2 p.m. and it's at the North Laurel Community Center, 9411 Whiskey Bottom Road. And you will have community assistance workers there on site, answering your questions, enrolling you, and you'll also get an opportunity to just come out and have fun.
I will say I went there last year. I brought my son with me and he had a ball. They had like a kids corner. They were making crafts. They were doing activities in the gym while the parents are making sure they stay connected. There was so much going on. There was food. So I just used me as she was there button.
And free parking. Free parking.
We hate to look for parking spots, so you don't have to worry about any garages. There's tons of parking. It's pull up in the parking lot, and it's within 5 steps, and you're in the building.
In the building. I love that. It's access coming into the building, starting with parking. Then once you get in the building, you have the open area, those who are there to greet you. Then you have your areas where you'll go and you'll actually get a chance to sit down with your cards worker. So it's awesome when you get that done. Then you can come out of there and they had other resources where you can talk to them. And again, like you said, if you bring your kids, it's tons of space. It's tons of space there. So it is definitely a great opportunity. We love that it's happening right after Thanksgiving. Of course, you can go out, eat, go out, do your little shopping, and the next thing you know, the next day you can just get back to business, stuffed and all, and handle it. Do your enrollment, get prepared for 2026, where you'll know that one check is off, health insurance is done. My famous saying for that one is, your health is your wealth. As long as you take care of yourself, you spend less. And so it's that opportunity to get in, get your questions answered, have fun, and also get enrolled in for your healthcare insurance for 2026.
Yeah, and actually, this is the perfect conversation at the dinner table, too. You know, there's always some conversation started. This is the one you want to start. There's not every conversation that's great for the dinner table. This is one good one to say, hey, if you didn't, I'm going to go over here, you know, tomorrow, next day, or whatever, and I'm going to make sure I get my things together. Like, you want to come with me, do a carpool, like encourage your family and your friends to make sure that everybody else is also enrolled, too.
I'm a big advocate for that too. That is the perfect conversation, because you'll have, now that we're going into it, the younger of the individuals coming in, they're leaving their parents' health insurance. Yeah. So that's like, okay, mom, so you're not choosing for me anymore? I gotta go out and choose my own. So that's the perfect time, the perfect intro. Like, okay, well, let me take you with, come with me. Let's take a ride really quick. We're going to go to this open enrollment event, and you'll get a chance to learn what are some of the things that you need to know when choosing your health insurance. You need to get these ideas. What is your deductible? What is your premium? So when you share that information early, they are prepared. Even when you talk about our more seasoned family members, they need to know the information too, because that transition of going from oftentimes them working to retiring, they need that information.
Yeah, no, absolutely.
Yeah, and we're also going through a crazy transition too for those who are either being laid off, being furloughed, or just at that point of being at that, as I call it, in search of employment, in search of maybe even a new career, and they need health insurance. This is your time to be able to get that coverage.
Yeah, absolutely. And we do have less than 15 minutes left. So no question is too big or too small. So just ask the questions. It's the perfect time to get the questions answered before you go and maybe do open enrollment. So type it in the chat. We're going to pop it up on the screen if you have any questions so we can make sure we get it answered. As we're going, it's funny because my sister last year, she attended the event with me, and she actually got enrolled. She is she's a hairstylist, so she's one of the ones who is more independent. So the hairstylist or whatever your company is, for someone whose income fluctuates, let's talk about that example. Like my sister, who is a hairstylist or a freelance artist, musician, working for nonprofit, even. How should they estimate income for subsidy eligibility?
Perfect. Entrepreneurs, that MarylandHealthConnection.gov is your tool. And going on to Maryland Health Connection's website, you will see what they call as the estimator. Oftentimes you can estimate what your yearly salary is going to be. You plug it in there. It's very people friendly. You're plugging that estimated number in there. After doing that, putting in there your county, you'll put in there the year that you're looking for health insurance, and it actually takes you step by step as you click next, and it'll let you see some of the plans. It won't be perfect numbers, but it'll be numbers that are very close, as well as an eligibility that's very close.
Okay, so make sure you get in. If you're right now and you're watching, you're like, oh my gosh, I'm so happy you told me this because I'm an entrepreneur. How am I going to do this? I know it's hard as entrepreneurs to make sure that you do have the coverage and open enrollment and things like that, but there are options, tons of options. Please make sure you take part in this. Like I said, my sister did. She has great coverage and everything is A-okay. Okay. She's in my family, so I'm going to take care of my family. So of course, I'm going to take care of you too.
Absolutely. It's truly a one-stop shop for Marylanders. Whether you are an entrepreneur, whether you are someone who is just out there newly looking for health insurance, or someone who is seasoned with it, who comes back repetitively every year during this open enrollment and you sign up. It is that place where you can go and get the information you need for health insurance.
Absolutely. So another DM I got once I posted that I was going to be doing this. It says, for someone who loses Medicaid eligibility, what is the transition process into a marketplace plan through Maryland Health Connection? Are there special enrollment periods triggered by that event?
Oftentimes there are special enrollment openings for you that's triggered. It'll show the actual end date for someone who is ending with Medicaid and now over scales as far as the financial and going into a qualified healthcare plan. It is usually an easy transition. It'll go from hopefully your last day of Medicaid into the transition of the qualified healthcare plan. I oftentimes try to walk individuals who are trying to go through that transition a step-by-step process because it is very different. The wordage is different. Knowing that you have to be able to put that into your budget to be able to pay monthly for, that co-pays are now required. So it's a transition, but it's a transition that's possible.
Yeah. And for those of you who maybe are just chiming in, I do want to make sure you didn't miss any of the facts that we gave you in the beginning. Mukeba, can we go back just a little bit for those people who just kind of chimed in and remind them, of course, what we're doing here and all about Maryland Health Connection. If you are just chiming in, we're talking about health coverage for Marylanders and, of course, recent federal changes that a lot of us have seen that will impact your health insurance moving into 2026. Can we remind everybody exactly what Maryland Health Connection is and how it works?
Absolutely. Maryland Health Connection is the state's official health insurance marketplace, the one-stop shop. With Maryland Health Connection, we are servicing all Marylanders. And that is the most important part. You want to know that we are servicing all Marylanders. You have to be a resident of Maryland. We have resource sites in almost every county. We have Baltimore City, Baltimore County, Anne Arundel County, Howard County, and Frederick County. So we are there and we have several resources as well as the Maryland Health Connection portal itself. You can always log on to there, marylandhealthconnection.gov, and you're able to look at several different resources there. You also can give them a call at 1-855-642-8572, and it's a toll free to reach Maryland Health Connection, and you will be connected with a community assistance worker. Well, for the consumers that are coming in to purchase, you have the opportunity to ask questions before you actually purchase your plan. So this is the time you have between November 1st and January 15th.
That means right now. Okay, right this second. Start doing your notes and then figure out what, of course, fits best for you. Because again, like you said, this plan is not one particular plan for everybody. You know, everybody has your own.
Yes, it's a definite. It's a one-stop shop, but it is not a one set for everybody. You have that opportunity to look and see what providers that you would like to join in. You have United Healthcare, you have Care First Blue Choice, you have Kaiser Permanente, you have WellPoint. So you have a plethora of plans as well as companies to be able to purchase plans with. You aren't feeling limited where you say, oh, I just have one, I got to stick with that one, and this is what I have to sign up for. No. And it's a multiple different plans as well as levels of a plan, levels of coverage. So you may want to purchase more. Some people say, hey, I want to purchase a plan that's an HMO. Hey, I want to purchase a plan that's a PPO. You have that option. You have that plethora of places and plans as well as companies to choose from.
Absolutely. Now let's talk about again what, of course, is covered within these plans that people will be choosing. There's a lot of different coverage options.
Absolutely. It's your health benefits, your doctor's visits, your prescriptions, mental health, and many other resources. You definitely know that in there we'll discuss with you not only your premiums and not only talking about the health coverages, your primary care visits, mental health visits. We'll also talk about what your premium or what your co-payments could be for your prescription. So each and every part, we pretty much try to talk you through. We even will give you an actual summary sheet. The summary sheet will state some of the basic estimates of what things could cost you, whether it be a pregnancy, a fracture. You'll see estimates for that when you get your summary sheet.
Okay, and if you missed it earlier, you know, with lots of big changes, recent federal actions will impact Marylanders as you apply for new and renew your coverage. Let's talk about those impacts affecting health coverage.
The effects you'll see this year with some of the new federal changes is definitely going to be an increase in premiums. In addition to an increase in premiums, the eligibility for certain Marylanders. If you are not reaching the 5-year bar and being not only a Maryland resident, but also a United States citizen, you may lose certain eligibilities. And one of those things is a tax credit to be able to assist you in paying your premium. You will be eligible to purchase health insurance, but you will not be eligible to receive that tax credit, that assistance, which will mean you'll have to pay the entire premium to be able to get that resource for health insurance.
Okay. Moving on also as you're hopping in, just want to remind you we have like less than 5 minutes left. So you can go ahead and get some questions in if you are hopping on right now with Maryland Health Connection. Mukeba will make sure she gets it answered for you. What should people do to stay covered? We want to make sure that we are covered this whole time and we want to stay there.
The way to stay covered is keeping up with your dates, knowing that it is what again, November 1st to January 15th, which is open enrollment. If you want to make sure that you're getting a coverage start date of January 1st, you want to have that open enrollment completed by December 31st. That's the only way that you'll be able to get that January 1 date. So you want to get in. If you're going in and you need to have supporting documents and information is due by a certain date, remember those dates. If you purchase a healthcare plan, you're going to need to make that initial binding payment before that date of January 1 because you want to be able to have that done, have everything completed. You want to work with that particular company that you have chosen. And the most important part, we need that card so we can go and get that coverage. We can go and see that particular doctor. So make sure that you're on time with those dates as well as keeping up with all of the requirements.
Absolutely. Keeping up with everything. That is it. We're going in with a plan and we're sticking with that plan. Of course, for those people who do have questions about open enrollment, what kind of help with enrollment is available?
There is a ton of help. Of course, you have that MarylandHealthConnection.gov portal. You have the multiple different sites, the resource sites that you can go to. Most important, if you feel like you just want to get that quick information, you can always call 1-855-642-8572, which is the toll-free number for Maryland Health Connection. One of the easiest ways to be able to communicate and get that person on the phone. Ask them a few questions. If you want to go in person, you have that opportunity. We are servicing Baltimore City, Baltimore County, Anne Arundel County, Howard County, and Frederick. So you have a multitude of places that you can go to and be able to sit in person with someone and receive that information that you need.
Absolutely. Mukeba, before we wrap things up, can you leave us with a couple gems as an expert who has been doing this for years? What are some things that we shouldn't be doing? Maybe some things we should be doing more of. I'm pretty sure you've seen a little bit of everything. So this, leaving us with some good gems.
I would say my one gem that I stick by is your health is your wealth. The same way that you make other things a priority of importance to you, make sure that your health insurance is one of those things that is a priority for you. Follow those dates, understanding that open enrollment is there November 1st to January 15th, and also being prepared before going into the office. Have some questions written down. Have some notes to say, hey, these are some of my needs. These are some of the resources that I would need to have. Be prepared for that and feel comfortable about sitting in that office with your community assistant worker. Feel comfortable with sharing your feelings, sharing your concerns, and understand that we are there for you.
Absolutely. Also, can you remind us of this open enrollment event that is happening?
Absolutely. Yes, we will be there. It is the post-Thanksgiving community engagement. It will be Saturday, November the 29th, and we will be at North Laurel Community Center, 9411 Whiskey Bottom Road, Laurel, Maryland, and we'll be there from 10 a.m. until 2 p.m. Come out, enjoy yourself, and also enroll and get your new plan for 2026.
Absolutely. And again, you can bring your kids. There's going to be tons of activities. It's a great time. You have tons of resources. There is really a lot of resources. When I went last year, I really was shocked at all the different great resources that were there. And just activities. It really felt like a fun place to be to handle some business.
Absolutely. I say it starts from the door. Free parking, free parking, free parking.
We love free parking. We don't want to be stressed out. That's where anxiety starts at is in the parking lot and trying to find parking. Then by the time you get in, you're like, all right, give me whatever. And then it doesn't fit what you really need.
And our greeters are going to be there. So please do not feel shy when you're going to the doors of where am I going to go? How do I know where to go to enroll? We have greeters starting from the front door that'll open. When we're telling you there, this is what's going on today. Hello, how are you? My name is, let me direct you here. You can have a seat here. So you will get a smooth transition starting from the front door. Parking lot, great parking, coming inside, feeling comfortable. And we treat everyone like family. We truly do. That is one of our models, to treat everyone like family. So you'll be coming back every year.
I love it. Thank you so much, Mukeba. This has been fantastic. Make sure you log on to marylandhealthconnection.gov. Any other thing else we need to know before we go?
That's it. Just show up, have a great time, come out to our next event. And sorry about that, it's giving me a timer today. Look at that. Come out to our next event. And our next event is going to be, don't forget that date. Remember, dates are important. November 29th at North Laurel Community Center. And this is in Laurel, Maryland. The address is 9411 Whiskey Bottom Road. It's a perfect time, 10 a.m. to 2 p.m. I'll see you there.
Absolutely. Open enrollment is right now. Make sure you get in with this and don't be too late too. Don't cram it in. MarylandHealthConnection.gov. Thank you so much and have a great night.